Hi, I'm Hope Jones, the Simulation Lab Director here at Bellarmine in the School of Nursing. And what this video is going to tell you about is our mid-fidelity simulators, also called the Vital Sims. You'll be coming to Skills Lab in the beginning of your nursing curriculum to learn how to perform skills on these simulators, and also you will be using them for health assessment. Our mid-fidelity simulators, the Vital Sims, they don't have quite as many features as the high-fidelity simulator, iStan. As you can see on her face, she is not able to open and close her eyes, and but she does have eyes underneath there, so if you'd like to assess for the pupils, you can look at those. You're able to take vital signs on this patient, and you can only take the blood pressure and the pulse over in one arm. You can see the specially adapted blood pressure cuff will already be in place, where you will take the manual blood pressure, and you may palpate a radial or a brachial pulse only in this arm of the patient. You're also able to auscultate lung and heart sounds on these patients. Anterior only on the front of the chest. And once again, the metal prongs sticking out of the anterior portion of the chest are for heart monitoring in more complicated scenarios. You may auscultate bowel sounds also on the abdomen area. When you're here in Skills Lab, you will also have a chance to practice medication administration on the simulators in this room. You can give injections, as you can see here on the thigh and on the shoulder and the deltoid area. Those are injection pads. You may actually draw up medication and inject them into those pads. There's a few things you're not able to get on assessment of the mid-fidelity simulators. The peripheral pulses are only palpable in the right arm of the patient. So if you need information on the extremities, such as pulse amplitude and strength, or capillary refill in the extremities, we'll label those, or we will provide that information for you. Once again, as a reminder, every patient has an identity, an armband, so you will use that armband to identify your patient by name, birth date, and or medical record number. Good morning, Mrs. Schuster. My name is Hope, and I'm going to be your nursing student today. I'm going to take your vital signs, check your blood pressure, your heart rate, your pulse, and your breathing. Are you having any pain right now? Okay, good. I'm going to ID you by your armband. Okay, can you tell me your full name and your date of birth? Okay, great. I'm just going to raise up your bed just a little bit so I don't hurt my back while I'm working with you here. The first thing I'm going to check is your blood pressure. Okay, when you check a manual blood pressure, the first thing you're going to do is estimate the systolic blood pressure. You're going to do that by palpating the radial artery, which there's an indentation on these simulators right here at the wrist. Okay, I'm going to place 2 pads of my fingers there, and I'm going to inflate the cuff. When I no longer feel the pulsation in the radial artery, that's the estimated systolic. I'm going to deflate the cuff, allow the patient's arm to rest for a couple minutes before I check the blood pressure. And I can no longer feel the pulsation at 120, so when I inflate the cuff, I'm going to go 30 millimeters of mercury above that. So when I inflate the cuff, I will go to 150. Okay, Mrs. Schuster, I'm going to check your blood pressure now. You're going to place your stethoscope right in the antecubital space. On a patient in the clinical setting, you would palpate the brachial artery and place it directly above that. I'm going to inflate up to 150. Then I'm going to slowly deflate my cuff, listening for the first sound and the last. Mrs. Schuster, your blood pressure is 118/68. Okay, that's in the normal range. That's a good blood pressure. Do you know what your blood pressure usually runs? Okay, good. That's about where you usually are. Next, I'm going to check the pulse. Once again, I'm going to palpate the radial artery with the pads of 2 fingers. You do want to be careful not to push down too hard. If you do push down too hard, you could occlude the pulse. So if you're having trouble palpating it, just let up a little bit on your pressure. Okay, I'm going to count this for 30 seconds. And at the end of 30 seconds, I'm going to multiply by 2. Ms. Schuster, your pulse was 74. That's also good. Okay, the next thing I'm going to do is check respirations on these patients in the skills lab. Their chest does not rise and fall, so you won't be able to count respirations by watching. But you can listen to their lungs on the anterior chest. So I'm going to place my stethoscope on the upper anterior chest and listen for inhalation and exhalation. That counts as one breath or one respiration. And I will also count that for 30 seconds and then multiply by 2. Mrs. Schuster, your respirations were at 14 breaths per minute. That's also within the normal range. We are not able to take a temperature on these simulators orally or axillary, so when you go through the motions, we will provide you with the information during your assessment. Okay, I'm going to get you comfortable here in your bed. Cover you back up. How's your position? Okay, you want me to put your head down just a little bit? I can do that. Okay, I'm going to lower your bed back down all the way here to make sure that you don't have too far to go next time you get out of bed. Okay, Mrs. Schuster, here's your call light. Whenever you need something or if you need to get out of bed, can you please push this and someone will come help you. It's right here by your arm. And that's an example of how you would assess the vital signs on the patients here in the skills lab.